We move now anterolaterally to Chupen, empty basin. This is the midpoint of the supraclavicular fossa, 4 sun lateral to the anterior midline. So if we remember that the clavicle is 8 sun, this would be the center of the clavicle. 4 sun lateral to the anterior midline. It's indicated for cough, asthma, sore throat, and pain, local pain in the supraclavicular fossa. This is an interesting point as well because all the primary yang meridians pass through this point except for the urinary bladder meridian. So all of the yang meridians meet at due 14, right, at the lower border of the spinous process of the 7th cervical vertebrae. All of the yang meridians meet there, the primary meridians. Here at stomach 12, all meet except for the urinary bladder meridian. Okay, so let's take a look at these indications. Cough, asthma, sore throat, pain of the supraclavicular fossa. Okay, based on those indications, what do you think the functions might be, right? Or the actions. I keep saying functions. I'm focusing a little more on actions here. So we have functions, actions, and indications. Yes? So look at the indications, right? These are the things that you might think of using, the signs or symptoms that if present, we might think, oh, stomach 12, Chupen might be a good choice. Cough, asthma, sore throat, and pain, local pain of the supraclavicular fossa. The actions: descend the lung qi and clear heat from the chest. There's your cough and asthma, right? Activate the channel and alleviates pain. There's your sore throat, right? Sore throat also can be caused by heat, so that can be related to the first action. Pain of the supraclavicular fossa. So I do this just so you can see that there is a correlation between actions and indications. And once you know one, you should begin to start being able to form a vague idea, like a good idea of what's, if you know the indications, you might be able to say, oh, well, and from the standpoint of an action, it must, descend qi or clear heat or activate the channel or course qi, right? And if you know the actions, if you look at the actions, descends lung qi, clears heat, activates the channel and alleviates pain, you would think, oh, well, obviously this would be a point that might be good for cough or sore throat or pain along the channel, particularly local pain. Stomach 17, Ruxiang. This point is called breast center, and that's what it is. This point is in the center of the nipple. In the 4th intercostal space, in the center of the nipple, 4 sun lateral to the anterior midline. Contraindicated to acupressure, acupuncture, and moxibustion. Right? We do not stimulate this point. The point is used as a landmark. Right? We know where stomach 17 is, and we can use that to help us find other points along the chest. Stomach 18, Rugen, breast root, directly below the nipple in the 5th intercostal space, 4 sun lateral to the anterior midline. And as we move down 4 sun lateral to the anterior midline, it's just here, right? We go into the 5th intercostal space, and then the channel moves 2 sun medially and continues its journey down the anterior portion of the body through the abdomen, 2 sun lateral to the midline and not 4 sun lateral to the midline. So we come to stomach 19, and then right down along that line, 2 sun lateral to the midline, until we get to the inguinal region. Stomach 18 diffuses the connecting vessel of the breast, quickens the blood, and transforms stagnation. Okay, so opening up the flow of qi and blood through the breast tissue. Okay, stomach 19. This is not a point that is on your syllabus, is one that you have to know, but I give it to you just as a landmark. This is where the channel moves 2 sun lateral to the anterior midline. So stomach 19, burong, not contained. 6 sun superior to the umbilicus, 2 sun lateral to the anterior midline. Stomach 25, Tian Shu, celestial pivot, front mu point of the large intestine. The location is 2 sun lateral to the center of the umbilicus, front mu point of the large intestine. Name Tian Shu, think about where it is, right? We are in the junction really between the middle burner and the lower burner, because generally the middle burner is between the diaphragm and the umbilicus. Below the umbilicus is the lower burner. Above the diaphragm is the upper burner. But this point, particularly as the front mu point of the large intestine, is the pivoting point between the upper body and the lower body. Right? And we see, qi that has been received and in the form of food and air and water and processed by our body and used, right, now is moving to the lower part of the body, where what is not usable to our body is being transformed into waste. As for action, the point promotes the action of the intestines, clears heat, and regulates qi, and relieves retention of food. So the point would be useful for signs and symptoms, indications such as abdominal pain and distension, right, which could be caused by qi stagnation or retention of food stagnation. Borborygmus, which is the sounds that your intestines make, that kind of gurgling, that is what we call an onomatopoeia, which is a word that sounds like what its name is, right, what it describes. Borborygmus. Pain around the umbilicus, constipation or diarrhea, because we're promoting the action of the intestines and regulating the qi. Dysentery, which is intense diarrhea. Irregular menstruation, and swelling, edema. Another way to think about the name of this point is that we can think of it's not only the meeting point of the upper body and lower body, but as such, the upper body is ruled by celestial qi, and the lower body is ruled by earthly qi. This is a place where those two points meet. Right? So 2 sun lateral to the center of the umbilicus, promotes the action of the intestines, clears heat, regulates qi, relieves retention of food. Used for abdominal pain and distension, borborygmus. Borborygmus, right, intestinal sounds that are not the normal intestinal sounds. Pain around the umbilicus, constipation, diarrhea, dysentery, irregular menstruation, and edema. Stomach 34. Lianchu, beam hill. This is our qi cleft point, right? A reservoir of qi and blood, used in cases of excess conditions causing pain generally. right? A good way to course. Remember we talked about the points on the leg of the stomach channel, the leg yang ming, right, being good points to move and course the qi and blood in the channel, right? So this is a point on yang ming, which is replete, full of qi and blood. That is a storehouse of qi and blood. Think about that, right? When the knee is flexed, the point is 2 sun above the lateral superior border of the patella. 2 sun above the lateral superior border of the patella. I do have a picture of this that I will show you in just a moment. Subdues rebellious stomach qi, right? Because it can help anchor some of that qi as a storehouse. Removes obstructions from the channel because it can help course the channel. And expels damp and wind. So pain and numbness of the knee, right? Those are signs of damp and wind. Stomach pain, mastitis, which is inflammation of the breast tissue, and motor impairment of the lower extremity. Again, because we're going to remove obstruction from the channel, right? Open the channel up. So if there's motor impairment, things aren't moving, which often can also lead to pain, then this can open that up, get things moving, and free the movement of qi, deal with the damp and wind, so we're dealing with the pain and numbness, and help free the movement of the lower extremity. I'll come back to this slide in a moment. I just want to show you, right? So here we have the superior lateral. See, this right here is the patella. Yes. Let's see if I can get fancy. Here we go, right? So we have a semi-irregular shaped patella here, right? We have the patella, right? And right here would be right here, really, right? If I was round, it would be right here. Yeah, see. There we go. The superior lateral portion. We come 2 sun up, and the point is here. Okay, you see I made a nice little measurement for you. Okay. And we'll be talking about stomach 35, do B, calf's nose, which is here, lateral to the patellar tendon or patellar ligament. Yes. And it's also known as lateral shiyan. Medial shiyan, right here on the medial side of patellar ligament, is an extra point. It's not on any channel, but it's an extra point for stiffness and pain of the knee. Right? These points are often used together for cases of knee pain. Okay, but here is the chi cleft point of the stomach channel, 2 sun above the lateral superior border of the patella.